you will know when you talk to the benefit advisor based on your drugs, if you get into the donut hole, how long you'll spend there, and the exact dollar amount that you're going to spend on medications every month. So it's full disclosure. Okay, full disclosure. In Franklin County, you can see that one of the core options, these Medicare Advantage plans, remember, they've got doctors, hospitals, and drugs all built into one plan. There are 19 of them available from Anthem Blue Cross Blue Shield, AARP, Aetna, Humana, and WellCare. So there are a variety of different Medicare Advantage plans available to you. For your Medigap and your Part D drug, for Medigap, you have 29 different Medigap plans available to select from Anthem Blue Cross Blue Shield, AARP, Sterling Health, Humana, Medical Mutual of Ohio, and Aetna. And before I forget, Summa Care is up here as well. Same deal for Part D drugs. There's a variety of plans from a variety of insurance carriers. Do not get overwhelmed with this slide. Okay, we're not going to give you all of these options. We're going to have that discussion with you and whittle it down to maybe one or two recommendations that meet your needs. The other point I try to make here is that regardless of how unique your situation might be, there is going to be a plan that fits what's important to you and is cost effective. Same deal, again, for vision and dental. You can select a VSP vision plan for $168 a year and get discounts on lenses and frames, and then eye exams as well. Humana and Delta Dental offer our dental plans. So if those are important to you, again, talk to your benefit advisor. As promised, we're going to talk about a Medicare Advantage plan that's available in this area. So what I did is I went back and selected just one of these 19 unique plans, just one of them, and I built out the basics of that plan for you to see. This policy is a PPO-type Medicare Advantage plan, Preferred Provider Organization. It has a flexible network where you can stay in-network or go out of network. You don't need referrals to see specialists. Okay? If you and I are going to discuss this plan, a Medicare Advantage plan, I am absolutely going to find out what doctors you see and what hospitals you'd like to use. And then I'll make sure they accept this type of Medicare Advantage plan before we ever even begin to discuss details. Here's how it works. It says that you do not pay a monthly plan premium for this policy. It is a $0 premium Medicare Advantage plan. All of the insurance companies will offer these $0 premium insurance plans, these Medicare Advantage plans. It doesn't mean they're bad policies. It doesn't mean they don't pay. It doesn't mean that they're not comprehensive. It simply means that they're being incentivized and subsidized by the government to offer these types of plans. They are extremely effective and they work very well. No deductible on this plan either. So it begins to share costs with you right away, instantaneously. You pay $20 to see your primary care doctor and $35 to see a specialist. For the first 5 days in the hospital, you pay $275 a day. Days 6 through 90, you don't pay anything. They kick you out after 2 or 3 days usually anyways. Emergency room, you have a $65 copay for an emergency room visit. And because it is a Medicare Advantage plan, it has the drugs already built in. And this specific policy says that for generic medications, you'll pay $7. For brand name drugs, you're going to pay $43. For non-preferred brand name drugs, you'll have an $85 copay, and then a 33% coinsurance for specialty medications. You can use a mail order pharmacy. There's only so much room on one slide to explain what these plans do, but rest assured it covers the entire gamut of healthcare needs you might need the plan for. Skilled nursing facilities, bone density testing. It'll cover durable medical equipment, things for diabetes testing and treatment. It'll cover x-rays, labs, all of those types of things. Silver sneakers in a lot of cases. So there are all sorts of things built into these policies to make them comprehensive and competitive for you. Maybe you don't like the Medicare Advantage plan, or you are sold on the idea of a Medicare supplement plan, and that's fine. What I've got up here are the Medicare Supplement Plan F, or a Medigap Plan F, as in Frank. It is the most comprehensive Medicare supplement plan that we offer. For a 75-year-old male, the premium for a Plan F is $164. For a 90-year-old male, it might be $180. But it'll be a little bit more if you're older, a little bit less if you're younger. But this is middle of the road. $164 for a Medigap Plan F. Any time that you go to the hospital, or any time that you go to the doctor with a Medigap Plan F, you have no deductible, no co-payments, and no co-insurance. You do not have any out-of-pocket expenses. So here's what I'm telling you. If you have a stroke, or if you have a heart attack, or if you need chemotherapy treatment, whatever it is, you have no out-of-pocket expenses for those types of things. Okay, so you don't get a bill 2 weeks later from the hospital for $1,000 or for $10,000. You're already paying $164 a month for the policy. It covers all those things for you. Same is true at the doctor's office. You don't have a deductible. You don't give the doctor $20 when you see him or her. It's covered for you. I also went ahead and added in a separate drug plan for $35. Just a middle-of-the-road drug plan to give you an idea of potentially how much it might cost and what the co-payments for a Part D drug plan might look like. So it says that you'll pay $4 under this particular policy for generic medications, $42 for brand name drugs, a $95 co-payment for non-preferred brand name medications, and again a 33% co-insurance for specialty drugs. You combine a Part D drug plan with a Medigap plan for full comprehensive coverage. So you choose either a Medicare Advantage plan or a Medigap plan. And as you can see, there are a whole bunch of different options that are going to be available to you. So there is something out there that fits your individual needs that's going to be cost effective. How do I pay for this? I imagine that most people in here are paying probably through a pension check of some sort into the group health care plan. And I think an individual pays $88 a month into the group health care plan every single month. Okay? At the end of December, that stops. Okay? You no longer pay for that group health care plan, so that's money coming back into your pension check. Additionally, Battelle has established a health reimbursement arrangement to help you pay for your qualified medical expenses. So things like co-pays and premiums are the two biggest ones. This health reimbursement arrangement is a tax-advantaged account, so you're not taxed on it, that's used to reimburse you for your qualified medical expenses. In order to be eligible for this policy, you do need to purchase a medical plan from Extend Health's exchange. A husband and wife will have a joint account, so you can dip into each other's accounts as needed if you need to throughout the year. The funds in these accounts roll over every single year. And it's going to be available for you on January 1st, 2013. Again, Battelle is allocating money into this health reimbursement arrangement. Okay, that goes on behind the scenes, nothing you need to worry about that. You work with myself or another benefit advisor to find an individual policy that covers you for 2013. And you are going to pay your premiums and pay your co-payments on your own, directly. So for your health care, or for your medical plans, whether it's a Medicare Advantage or Medigap, during the application process, we will help you set up for payment to the insurance carrier. Nothing you have to do on your own. We'll help gather your bank account information. We'll set it up on the application so it just gets drawn from your bank every single month. You pay the premium directly. You pay your co-payments directly. You will get reimbursed for those expenses from your health reimbursement arrangement. Let's talk about how. So there are two ways to get reimbursed for your expenses. The first is to submit a paper claim form. Okay, so here's how that works. You pay your premiums. They're getting drawn from your bank account. You might go pick up 5 or 6 drugs over a few, 2 months, maybe more. You keep those receipts, and you're going to fill out one of these manual claim forms with all of your information, and you're going to submit it by faxing it to Extend Health or by mailing it to us. Okay, we'll get that. We will verify it's all true. And then we'll send you the money back from your health reimbursement arrangement. We will reimburse you for your expenses. It's sort of a pain, sort of a process that's going to take some time. So we do not provide accountants, which was the question. But what we do provide is what we call automatic reimbursement. Okay, and this is what I encourage everyone to take advantage of. When you and I are on the telephone and we're talking about plans and we find a plan, I'm going to ask you, do you want to set this up for automatic reimbursement? And he'll say, yes, I do, Colin. I'll notate that on the application on my part. I'll help him set up for payment for his plans where he still pays the insurance carrier directly. It happens electronically. It's just a one-time setup thing you have to do, and I'll do it with you. I'll do it for you, rather. And you're done. Every single month, the insurance carrier will draw premiums from your bank account. What happens that you don't see is that my company, Extend Health, goes behind the scenes and verifies that you're paying your premiums every single month with the insurance carrier. So we go behind the scenes and make sure you're still paying. So once a month we'll do that and we'll say, hey, Mr. Jones is doing it. We'll just send his money back to him. So we'll put the money directly back in your bank account, or we'll cut you a check, whatever you want, and it's done. No paperwork. You don't have to submit anything. You don't have to file a claim form. The caveat is that for prescription drugs, you will have to submit a claim form, which is kind of a pain. I get it. Or if you have a doctor copay. So you can submit those on a monthly basis or a quarterly basis. But it's still a pretty simple process. It works well. Automatic reimbursement for the first reimbursement sometimes takes up to 6 weeks. After that, it happens like clockwork on a monthly basis. So Part B, everyone in here probably pays somewhere in the realm of, I think, $96.40 for Part B of Medicare. You cannot use your health reimbursement arrangement to get reimbursed for your $96.40 or whatever it is you're paying, $99.40, whatever it is. However, any co-payments that you have at the doctor or any co-insurance amounts you have at the doctor or in the hospital, you certainly can use your health reimbursement arrangement for. And we'll address it more in just a minute here during the question and answer. So that everyone is aware, towards the end of December, you'll get an HRA enrollment kit that explains what all of your qualified medical expenses are. It'll reiterate to you exactly how much your HRA is for. It'll provide you some of those paper claim forms. And it'll have some questions and answers on how HRAs work for you too.